The treatment landscape for neuroendocrine tumors has evolved quite a bit in the past few years. I think we're very fortunate to have had a number of new FDA approvals in the last 5 to 10 years. And that gives our patients many more treatment options. I think really an unanswered question is, what is the optimal sequence of therapy? The main principles that guide treatment selection are really twofold. There are characteristics of treatment and characteristics of the patients or their tumor types, and I'll maybe split those up a little bit. So, characteristics of treatment include both potential side effects of therapy and the outcome measures. So, I'll go into some detail there. So, in terms of side effects, this ranges considerably depending on the class of therapy and depending on the therapy itself. So, for example, somatostatin analogs have a very favorable side effect profile. They cause very few side effects. Patients tolerate them quite well and have good quality of life. And so perhaps patients who are older might tolerate those better, or we know that patients who are completely asymptomatic starting a therapy, that might also be a good one to start with. Chemotherapies tend to have more side effects, so we just talk about that risk-benefit ratio with patients. And in terms of outcome measure, what is the goal of the therapy? So will the therapy shrink the cancer, or will the therapy solely control the growth and prevent further growth? And I think different patients need different outcomes depending on what symptoms they may start with or what the status of their cancer is when we're thinking about that therapy selection. In addition, characteristics of the patients also guide treatment selection, and I think that they fall into 6 main categories. That includes hormone status, so whether a patient has a functional or non-functional tumor, extent and burden of disease, pace of disease growth, whether they have a well-differentiated or poorly differentiated tumor, and grade, so grade and differentiation, the primary site, so where the cancer started, so lung, gastrointestinal tract, pancreas, or other. And then I think the 6th is the somatostatin receptor status, which has become even more important as we've had the advent of the gallium-68 dotatate PET CTs. So all 6 of these features I think about and actually really try to think of answers for each of these as I'm selecting therapies for patients.